I am Dr. Chandrashekhar Godbole, a practicing anesthetist for the last 40 years. I am going to speak to you about a wonderful and a magic word, that is anesthesia. First of all, no painless surgery was possible before the advent of anesthesia in 1846. That means for any type of surgery, some type of anesthesia is a must. Now, what are the types of anesthesia? First, there is general anesthesia. That means the patient is unconscious or asleep for the period of surgery. Second type of anesthesia is local anesthesia. That means patient is awake but pain-free for the duration of surgery. Now, something about general anesthesia. We can give general anesthesia with the help of two things, either by intravenous injection or by inhalational technique. That means the patient breathes the anesthetic gases. Now about local anesthesia. Local anesthesia is anesthesia produced locally with the help of an injection. If the surgery is on a small part of the body, anesthesia can be injected near area of the surgery, that is called a field block. If a surgery is to be performed on a limb, that limb selectively can be anesthetized, that is a limb block or a nerve block. The third and most important thing, where the half of the body is anesthetized by injecting the drug in the gap in the spinous processes. That is called as a central neuraxial block. It is either spinal anesthesia or epidural anesthesia. Now, over the period of years, for about 150 years, people have worked very hard to make anesthesia very, very safe and sound for you and me. This is possible because of excellent new and time-tested drugs, excellent engineering giving us excellent machines which give very, very monitored anesthesia, excellent monitoring machines which continuously take care of the patient, monitoring during and after surgery. First of all, the pre-anesthetic checkup, where we decide whether a particular person is fit to undergo anesthesia or not, or what extra care has to be needed depending on the medical condition the patient has. Fourth and the most important thing is that the training of the anesthetist over the last many years. Now, about some myths about anesthesia. Will I wake up after general anesthesia? Yes, unless the patient is suffering from a very, very serious medical condition. Almost all the patients wake up nicely after general anesthesia. Now, will I get paralyzed after spinal anesthesia? With proper care, it is now nearly impossible. Will I get backache after spinal anesthesia? Thanks to the new fine needles available and fine equipment, this is very, very rare. To summarize, we can say that today, with modern anesthesia, the risk of anesthesia can be compared with crossing a heavy traffic in a metro city. Thank you very much.